I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic echographic and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve, take account for.
Hello, old friends. It's your old pal, Dr. Steve from Weird Medicine. Let's turn that down. Goodness gracious. All right. Still working out. I've got a weird problem with video coming from the internet, and it sounds terrible on my live stream, so I got to work on that. But anyway, it's good to see everybody. I've got a couple of things that we're going to do. I just placed a link to the live stream on our Patreon, patreon.com/weirdmedicine. And happy to see everybody. Let me get rid of... So we had a couple of questions about whole body MRI, and this was from one of our Patreon subscribers asking about, are these things worth anything for screening purposes? So let's talk about an MRI. MRI uses a very strong magnet, and I don't know if you know this, but electrons have what's called a magnetic dipole, which means that they're a little bit more positive in one direction than they are in the other. And so when you put someone in a very strong magnet, the hydrogen atoms and the electrons that surround them will lock into step, and they will precess. They will precess around the axis like this. And then once you get them in sync in this magnetic field, then if you bombard them with microwaves at certain frequencies, they will flip to the higher energy state. And when they do that, they'll sit there for a while, but they want to go back to normal, and then they'll pop back. And when they pop back, they'll release photons at a specific frequency and energy that you can detect. And so you pile these microwaves in, and then you get return. And the frequency and energy of the photon that comes back has a lot to do with how that hydrogen atom is attached to the carbon atoms in these organic molecules. And when I was in pre-med, I did some research on nuclear magnetic resonance, where we were detecting chemical compounds that way. And I actually discovered a really cool molecule doing my research, and it was discovered or figured out by my professor, Slayton Evans, who was just a genius. And he looked at it and said, oh, this is a lactone ring. He could tell by looking at the NMR tracing that it was a specific configuration. Well, anyway, so when you do that, you get all these really cool pictures. So let's see if I can just find MRI images, and there you go. So they look much better than what you're normally used to. Well, come on, in say CT scans or X-rays, but and the other benefit is that there's no radiation. The only radiation is microwaves, and it's very low level, non-ionizing radiation. So, and you get better pictures. So, every time you have a CT scan, you increase your risk of solid tumor by a small percentage. Not so with the MRI. But the downside is it takes longer. When I first started in this business in the 80s, it would take about 30 minutes to do a CT scan, and they had a whole mainframe computer. Now you can run a CT scanner basically off a laptop. And the cardiac screening that we do takes maybe 3 minutes, if that. So it's really come a long way. So I'm hoping MRI will come a long way in the future. But for now, you have to go into a tube. It's very claustrophobic, and many of these things last 45 minutes. I had a tumor on my finger, it's still there. It's mobile. My hand surgeon said, "Oh, it's an osteochondroma." It's like, no, it's not. It's an osteochondroma would be fixed. This is mobile. And he's like, "Oh, yeah, like So, stupid palliative medicine person." So anyway, so I had to get an MRI. I thought the MRI would be I would be sitting in a chair and stick my hand in the tube and just sort of sit there and read a book. Oh, hell no. I was in there on all fours on my knees and my elbows for like 35 minutes, praying to God I would get out of there, and making all kinds of deals, which I probably didn't keep. But if I just got out of there in one piece, it was awful. And I'm pretty okay being uncomfortable, but this was really uncomfortable. Anyway, so the question was, is this worth anything for screening? In other words, you just get in the MRI and just scan your whole body and see if you find anything. Well, here's the problem. If you, so the definition of a screening test is a test that is inexpensive and has high sensitivity. In other words, it casts a wide net and it catches all of the cases that you could think of that you would want to catch. And therefore, it's going to have a lot of false positives. And then you should be screening for a disease that is common and treatable. And because there's no point in screening for rare, untreatable diseases, because all you're doing is terrifying people, and you'll get more false positives than you will true positives if the disease is truly rare. So that's the first thing. So you're already getting an idea that a whole body MRI for screening purposes may have some problems in that regard. Now, so there is a company, it's called Prenuvo. They'll scan your whole body for $2,500. And so here's this, Very Well Health. It's an okay website, but we'll go to the literature before we get done. It supposedly detects 500 conditions. Does this sound like Lifeline screening to you? I did do Lifeline screening because I could get a carotid ultrasound, whereas no one's going to do it on me because there's no indication for it. It was just kind of interesting. I wanted to see what it showed. So for $50, I could get that done. They offer this full body MRI screening, and they are useful in detecting abnormalities in the body, but they create anxiety, particularly when you have a false positive, which is likely if you have a rare disease that we're looking, or that they find, or that you're looking for. You may end up with more false positives. So anyway, so here we go. This person booked an appointment at Prenuvo. They offer full body MRI scans, and it's about an hour long. It's unbelievably noisy when you get in there, and they focus on preventative health, but radiologists say that full body MRI scanning can do more harm than good. Well, how is that? Well, here we go. Ding, ding, ding. False positives. And detection of benign abnormalities, which are true positives but can still scare you. For example, there's a type of tumor in the lung called a hamartoma. Can look like a malignant lung nodule, but is completely benign. But this patient thought it was worth overriding her doctor's skepticism to gain some peace of mind. And if you find breast cancer early, if you find a colon cancer early, it's probably worth doing. So let's look at the actual literature and see what they're actually finding. So this is whole body magnetic resonance imaging for cancer screening in asymptomatic subjects. That's what we're interested in, is we're taking someone with no symptoms, throwing them in an MRI just to see if we find something and we can catch it early. Now, we do this with lung cancer screening now with low-dose CT scanning, but you do that in people that are high risk, like me, that used to smoke a shitload of cigarettes. And then you can look and see if they've got any early tumors. You catch them early, you get rid of it. Cancer is a very treatable and even, dare I say, curable disease when you catch it very early. Well, anyway, all right. So let's look at this study. Whole body magnetic resonance imaging for cancer screening in asymptomatic subjects of the general population, review and recommendations. And this is from 2020, so it's relatively recent. The research was probably done in 2019. So and this is a study of studies. So they identified 12 studies encompassing 6,214 whole body MRI examinations, and the 11 of the 12 studies provided imaging protocols that included T1 and T2 weighted sequences. Don't worry about that. It's just a different way of dialing in the images so that they'll show different things. For example, on some of those, fluid will be black, and some of those, cerebral spinal fluid, for example, will show up white, and you can get some interesting contrast by changing how you weight these things. Well, anyway, so of 17,961 abnormal findings reported, 91% were benign. So they had a 91% detection of benign things. 9% were oncologically relevant, and 0.5% of lesions were suspicious for cancer. So you run 200 people in there, you get one that might have something. Is it worth doing? Maybe. So what you have to do now, so their conclusion is, they're too heterogeneous to draw impactful conclusions regarding efficacy. So who cares if you can find these things? The question is, do you save lives doing that? When you throw someone in a whole body MRI scanner, are they more likely to be alive 5 years from now than they would be had they not done it? That's the question. Okay, and that is the thing that we don't know the answer to. All right, let me, just for fun, let's just see if there is any all-cause mortality. Any studies that look at this? So, no, it doesn't look like it. Okay, cardiovascular whole body MRI. Well, might be something. Let's look at that. Okay, non-invasive exams. Okay, sorry, wait, I'm not showing it to you. Non-invasive exams like the ankle brachial index, that's where you take a blood pressure in the ankle and then do it in the arm. And then you just make a ratio. And if the ratio is greater than 1, in other words, or 1 or greater, so that the blood pressure in the ankle is the same as it is in the arm, that's good. If it's less than, you've got decreased blood flow to the ankle, and it may be due to a clog. And this is a very simple screening test. Let's see if it meets the criteria. Is it inexpensive? Yeah, it's basically free. It's just blood pressure. Is it looking for a common illness? Yes, peripheral vascular disease, particularly in this country among smokers, very common. Is it treatable? Absolutely. If you have it, there's medication. You can also put in a stent or a balloon and open up your arteries and increase your blood flow. And is the test relatively sensitive? Yes, it is. So it really meets the criteria for a good screening test. Is MRI inexpensive? No, I wouldn't consider $2,500 to be inexpensive. So let's see. Echocardiography is an excellent technique to assess cardiac function. MRI constitutes a non-invasive imaging modality without ionizing radiation. That's a big deal. So without increasing your risk of cancer, offering excellent reproducible image quality. But again, this is not the study we're looking for. These are not the studies you're looking for. We want to find a study that shows that there is decrease in death in patients that have this done. So here you go, 10-year prospective evaluation of whole body cancer screening with multiple modalities, including 18 fluorodeoxyglucose positron emission tomography in a healthy population. So let's talk a little bit about 18 FDG. So this is basically a glucose that's labeled that gives off antimatter, gives off positrons. And when those positrons hit an electron nearby, they both annihilate, emitting gamma rays that can be detected in a detector. And that's what a PET scan shows. And they're pretty interesting for, because glucose is metabolized by cells. If you have cells that are metabolizing a lot, like cancer cells, then you will see an increase in activity in the cancer, in the tumor itself, and it shows up that way. All right. So cancer detection by PET alone was limited. Oops. Uh-oh. Oh, boy. Oh, boy. What have I done? Oh, boy. Let's try that again. Okay. Clicking on the wrong place. Sorry. So they had a good follow-up rate, 99.8% of the screening period, 96.2% for the follow-up period. 45 cancers were confirmed during the screening period, and 14 of the 45 were PET positive, so about a third of them were. So let me see. Let's just see what their conclusion was. Cancer detection by PET alone was limited, while high cancer incidence was attributed to extensive screening. Low cancer and all-cause mortality may indicate the potential value of this type of cancer screening. There you go. There was low all-cause mortality. Now, did they compare this against people that didn't have this done? I don't know that they did. I think let's see, the rates of cancer mortality and all-cause mortality of 65.6 and 153.2 respectively were significantly low compared with the general population. So there you go. So this actually may have some value. That's all we care about. If you had a cholesterol medicine that would make your cholesterol 600, but it would let you live to be 110, we would do that. We'd do that on everybody. Who cares what your cholesterol is if the outcome is improved? So we look at cholesterol as sort of a secondary indicator. In other words, it's hard for me to look at your coronary arteries, but we know that low cholesterol is correlated with less coronary artery disease. So it's very easy to check someone's blood for cholesterol, but it's a secondary measure. Again, we look at cholesterol medications and say, well, they're good if they lower your cholesterol. But what we really care about is, do they lower the risk of coronary artery disease? And if the answer is no, which was the case with a drug that I'm not going to mention, that had coronary, improved reduction of LDL, but did not improve at all outcomes, it was worthless. It's worthless. So anyway, I can see that the chat thing is not working. So I'm going to, at some point, I'm going to have to get rid of that. I see that there are people in the chat room. I'm sorry that I didn't see you all earlier. I see Amanda Swan. Let's talk about uncomfortable, weird, wild things. It doesn't take $2,500 to fix out or fix. Very good. Dabblestorian. Hello, my friend. If this isn't going to work the way that I wanted it to, I did see that somebody became a member and a Myrtle popped up. So if you're not a member, become a member and see if Myrtle pops up. Click that. You don't have to pay. I think you can just subscribe. Just subscribe. I'm not asking you to pay any money. Let's see here. Ryan, what are some uncomfortable, weird, wild things you'd like to discuss? Yeah, I agree. Amanda Swan says it's too fancy. Radish Div Network. Welcome to the Fluid family. Thank you, my friend. All right. Let's see. Colin Card, danged old fluoroguvulose positrons. I think they made that up. I agree. Okay. Josh from New Jersey has a question. Dr. Steve, can pancreatic insufficiency symptoms be similar to some type of bile blockage? And and Radish Div Network gifted 5 memberships. Thank you, my friend. Turn your accept memberships on. because Richard Kish just got a free membership. Josh from New Jersey got one. They're only 99 cents. Dabble Storian got one. Terry No and Talk Like a Hick are now members. So thank you, Radish Dev, for that. So let's talk about pancreatic insufficiency. So those are people who have a decrease in pancreatic enzymes. What do pancreatic enzymes do? The pancreas is one of the few, it's the only one I can think of that has exocrine and endocrine function, the only organ in the body. That's not really true. There are others, but it secretes pancreatic enzymes, and it also into the lumen of the small bowel, but also secretes insulin and other peptides into the bloodstream. So that's the endocrine function. Exocrine function is pancreatic enzymes, digestive enzymes going into the small bowel. And if you have a dearth of those, well, what do pancreatic enzymes, what purpose do they serve? Well, they help to dissolve or digest fat, to break fat down. If you can't break fat down, you're going to pass it all the way through, and you're going to get bloating, cramping. You may have bowel movements, and if you look at them after you move your bowels and you see oil floating on the surface, that could be a sign of pancreatic insufficiency. So you'll have some pretty serious symptoms of malabsorption. That's what that is fat malabsorption. So hopefully that was a theoretical question more than anything else. I saw a bunch of memberships or subscriptions go through, so that part's cool. I don't know why the chat box over here on the left is not working. Let me show you. This over here, this chat box is supposed to show up with all this stuff that's over here, and I don't know why that's not working. But anyway, all right. Some more breakthroughs. Okay, all right. Come on, can we? Enough with the ads. How do I get rid of that? I just want to show you this story. Oh boy, now I've done it. Okay, anyway, artificial womb for premature babies could be available this year after 300 tests with lamb proved successful. So I used to work in the neonatal ICU, and it was, we called it baby hell. And baby hell was little premature babies that were, had tubes coming out of every orifice. And if they were young enough, we knew they were going to have problems with lung capacity, maybe retinal blindness, all kinds of stuff. And we always said if we just had a artificial placenta, the preemie comes out, you put them in a vat of saline, hook catheters up to their umbilical artery and veins, and then go from there, or umbilical arteries and vein. Oh boy, it's been too long. Let me see. Anatomy. Oh, sorry. Anatomy of the umbilicus. Let's see if we can get a good cross section. Let's see here. Okay. Come on now. Give me a good cross section of this thing. I think it is. Yeah, 2 arteries and a vein. There it is. Okay, 2 arteries and a vein. So you would hook catheters up to these and then just dump the kid into a vat and give them the proper nutrients through these catheters and let them just float, and they don't have to breathe. They don't have to be exposed to oxygen too early. That helps prevent retinal blindness. It also helps prevent lung disease and things like that, because oxygen is toxic substance, really. And so that's apparently now they have one. They tried it in lambs. They did 300 of them, and now we have an artificial placenta. They're saying artificial uterus. Kind of, that's right. The surrounding is the uterus, but it's the artificial placenta is the important part. And let's see here. So let's see what there's the picture of it. Looks about what I thought it would be like. Now this is a bag. I always sort of thought they'd be in a big glass jar, but okay, this makes more sense. And here's those catheters, and there's a sterile. This has to be completely sterile. Can't let bacteria get in there. So that's a thing that you have to deal with. So they'll have to, they'll have a protocol for that. But artificial uterus works in two ways: by connecting the fetus's umbilical cord to an oxygenator, which circulates the blood and places it in a fluid sac mimicking the womb, and allowing the fetus to breathe and swallow amniotic fluid. Do you know what amniotic fluid is? By the way, here's a fact that you can use at a cocktail party. Amniotic fluid is actually urine. It's baby urine. They're pissing in there. And if they have a condition that blocks off their bladder outflow obstruction, they'll get oligohydramnios. That's one way that they can get it. And they'll have too little amniotic fluid in the uterus. So anyway, so let's see here. They used lambs because the majority of knowledge about human fetal development was derived from lambs, so fair. These lambs were born between 106 and 113 days, the equivalent of a 23 to 24 week premature human infant. And they shared that by the end of the test animal stays in the artificial womb, they had stable nutritional status, even though the lambs were not feeding on a sheep. Liver tests were positive. Brain growth was normal. This is amazing. Now, if we can turn this around to do in humans, it's going to change neonatology. Heck, if they'd had this, I might have gone into neonatology because this is fascinating. It's let me see. The FDA held a meeting with more than 24 experts, including neonatologists, pediatricians, and bioethicists, to discuss what steps to take to conduct a human trial. So it's very exciting. So it said that they're going to announce their decision later this year. When was this written? I just saw this recently. Yeah, 4th of January, 2024. So where do we find clinical trials? We go to clinicaltrials.gov. Come on. All right. I don't want the API. I just want clinicaltrials.gov. Thank you. I get nervous when people are watching me type. I think that's what it is. All right. And let's just see if they have premature birth and intervention treatment, artificial placenta. Okay, not yet. Now, they may be using a different set of keywords, but let's just put artificial and see if that comes up anything. Nope. Okay. So nothing has been approved yet, and nothing's been started yet. But that's very exciting. So I think that bodes well for the future of kids in who are premature. Best thing is to prevent premature birth if you can, but you can't always prevent it. See if there's anybody else in here. Josh from Jersey says lamb is delicious. Radish dip. I do have super tips hooked up, but I don't have the artificial voice. So he's saying, can you get super tips hooked up, please? Let me see if I can. I got a medical question. It'd be fun if someone else reads it. I emailed them and said, listen, I would like to have that because it is fun. It's fun to do that on Melton's screen and have Ray DeVito read your super tips and stuff like that. So I don't know. So we'll, it's I'm trying, but they're not getting back to me on that. All right. Josh from New Jersey says lamb is delicious. Cardiff Electric says cease and desist. I guess I'm just going to have to go back to StreamYard, but I really kind of like having Myrtle pop up whenever somebody subscribes to the channel. So anyway, oh, thanks, Josh. I appreciate it. Those very kind words. Oh, there's Cardiff Electric. My rectum hurts ever since I met you. Any advice? Yeah, increase the fiber in your diet and use a better lube. I guess I don't know. What am I? Some sort of comedian. All right. Josh from Jersey says Cardiff Electric, hemorrhoids or genital warts, and thank you for the Canadian 279. You know, equivalent to some amount of money in real money. Uh, here's a question. Let's see. Oh, I don't know if you guys can hear that. I don't know if you all can hear that. Can somebody tell me? Could you hear the phone call? And Amanda, what? Okay. Oh, yeah. Okay. I'll answer Amanda's questions while I'm waiting for an answer on that. So Amanda says scabies. Is it just not just for pirates? And then what do you call pirate treasure? Booty. Okay, got it. Yeah, scabies is anybody can get that. It's if you've ever had a dog with mange, it's called sarcoptic mange, and scabies is caused by sarcoptic lice. It's the same disease. So basically, when you get scabies, you're getting mange. You just don't have hair all over your body. And so let me show you what scabies would look like. Let's see here. Normally, you will see little burrows. And here we go. Okay, let me switch over to this. So it looks like poison ivy, but often it will be in a time of the year when there isn't any poison ivy. Look at that. It looks just like poison ivy. But if you look closely, sometimes you will see little lines where the lice have burrowed under the skin. And to properly diagnose this, they need to scrape it and find one of these lice under the skin. If they just go, you got scabies, they're just making that up. They really need to diagnose it. And I'm a little bit bummed at some of my colleagues' inability to take 5 minutes and just try to diagnose something. Let me see if I can find a good one. Oh, okay. No, thank you. Well, yeah, see how it looks like? There's a burrow. See the burrow? So the bug is in here, but it burrowed from here to there. And then they lay eggs in the skin, so you could kill the things themselves. There's some burrows. And you could kill the eggs, or the things, but their eggs will live, so you have to, there's a protocol for treating this. And so if you get a dermatologist or an infectious disease person or whoever, and they give you a protocol, follow it to the T, because if you don't, there will be issues. And these that you could get rid of them for a short period of time, and then they just come right back. All right. Hopefully that answered your question, Amanda. Let's see. I don't know what that means. Dabblestorian says, "Are you still doing Dela's dishonorable discharge?" I'm not. I don't know what that means. Okay, so let me try this, and I'm going to see if I can see the. Okay. Can you all hear the guy say that he had hepatitis C on screening blood work? No. Okay. Kim said he can't hear it. Okay. I'll have to work on that. I'm going to have to. I got an idea how to fix that. Anyway, so that was Clint from 2020. And he said that he was doing a screening test and to donate blood, and he found hepatitis C antibodies. he said, what do I do now? Well, just because, this is a screening test. So a screening test is supposed to cast a wide net, and they probably used a cheap version of the hepatitis C screening test. It might have been what's called an ELISA or an immunoassay, which can cross-react with a lot of things. So what they have to do is when you have an unexpected test of any sort, what you have to do is repeat it. And you repeat it with a more specific test. So a test, they could do Western blot. They can do, there's a bunch of different tests that they can do that are the gold standard to look at hepatitis C antibodies. You also want to know, do you have active infection? So there's a whole series of blood tests. They can do it in one shot that looks at, are you currently infected? Were you previously infected? Is it an emerging infection or is it a chronic infection? And so that's what needs to be done. Of course, that was 3 years ago. Hopefully that's all taken care of. All right. Crystal Williams super chatted at $2. Thank you, Crystal. Let me see if I can find that. For some reason, I am really going to have to get my crap together. I know I keep saying that. Okay, Crystal Williams. Oh, thank you. Let's celebrate their first super on a live stream. Thank you, Crystal. I like this up here where it says latest subscriber was Donna Chada, and that latest super chat was Crystal Williams. And I like when Myrtle pops up. I may try to use the StreamYard OBS. Nobody cares. There's a way to do it, but then it flickers. So I need some help is what I need. I was an audio engineer. I did championship wrestling in the 70s, and I quit television and radio in the 80s to go to medical school, and then ended up, doing this. But in that meantime, a lot of stuff changed, and this digital stuff is, I feel like the caveman on Saturday Night Live that Captain Carl used to do, where your modern technology frightens me. So I'm going to have to get a producer or somebody to help me do some of this stuff, but I'm working on it. I'm going to talk to OJ about it tomorrow. Okay, Richard Kish. Hey, Doc, I had blood work done recently. My PSA was elevated. 5.5. Urologist gave me an old-fashioned exam, said it was smooth and seemed okay. Second blood test, it's down to 4.5. And he wants me to get an MRI. What's he looking for? Well, so he did the screening test. A lot of people have false positive PSAs because as the PSA enlarges, or the prostate enlarges as we age, it just starts producing more prostatic-specific antigen. So there's been controversy back and forth about PSA for screening for prostate cancer because you end up getting a lot of false positives, a lot of people having biopsies that don't have cancer. One of my best friends had the transrectal biopsy because remember the back part of the prostate is the front part of the colon. So they went in through his anus and stuck a needle into his prostate and took a bunch of cores, and that was great. It's easy access, easier than going through your taint, which they used to do. But they got bacteria in his prostate, and he ended up with bacteremia and sepsis and a fever of 104 and, low blood pressure and all that stuff. So, it caused him, and he didn't have cancer. So the MRI is another test where they can look to see, is there anything heterogeneous in there, or does it all look like nice, smooth, just sort of extra meaty prostate? And the old saw is that if you take 100 people that are 70 and above and who die from something other than prostate cancer, and those people, you do an autopsy on them, about half of the men will have prostate cancer, never knew it, didn't contribute to their demise. So there you go. Okay, let's see. This is the weirdest live broadcast you've ever done. Is it? Okay, well, I guess that's good. It's called Weird Medicine, right? Let's see. If you're donating plasma, they apply the result of a test on one sample to all the others in the bunch. I'm not sure what you mean by that. You mean everybody in the same day that you went in? You might want to call in about that one. Okay, does the supplement N-acetylcysteine help with fatty liver? Is there any danger from taking it? Well, how would we find this out? We would go to our good old friend PubMed, and we'll look at the data, the actual data. And I like that you asked, is it good for this specific thing? So N-acetylcysteine, yes, delightful. And fatty liver. Okay. Okay. Protective effects of N-acetylcysteine against binge drinking induced fatty liver in mice. That's something. That's a murine study, not so great. Recommendations for the use of acetaminophen. Okay, so yeah, people who take too much Tylenol, we give them N-acetylcysteine to block those receptors. Okay, here we go. I think this is the study you're looking for. N-acetylcysteine ameliorates high-fat diet-induced non-alcoholic fatty liver disease and intracellular triglyceride accumulation by preserving mitochondrial function. Well, isn't that something? So yes, if someone has non-alcoholic fatty liver disease, in other words, it's genetic, maybe they are a carrier for alpha-1 antitrypsin deficiency, or they're just genetic and they have fatty liver because fats tend to accumulate in their liver, but not caused by alcohol, at least in this study. Now, this is a mouse study again, so I would like to find a human study. So, but in this one, it certainly seemed to be beneficial. So let's do this. We'll do minus murine. That should give us the non-mouse studies. Yeah, yes. Okay. All right. Let's see if we find anything interesting here. Comprehensive analysis. Meta-analysis identify therapeutic effects of N-acetylcysteine in non-alcoholic fatty liver disease. Hopefully this is in humans. Okay, 13 studies were included, so this is a study of studies. And it showed that N-acetylcysteine treatment significantly improved systemic and hepatic lipid metabolism, inflammation-related liver injury. That's great. With a P of less than 0.01. That's statistically significant. In other words, what that means is that the odds that this occurred due to chance are 1 in 100. Improved glucose intolerance and hepatic fat. That's what steatosis means, is fat in the liver. Consistently, let's see here. Our study suggests N-acetylcysteine has therapeutic potential for non-alcoholic fatty liver disease and should be considered for future clinical trials. So let's go back to clinicaltrials.gov. Not the API. Come on now. And let's look it up. So, fatty liver. Yeah, okay. Non-alcoholic. I could type 140 words a minute. I don't know. Okay. I get nervous when you all are watching me. And N-acetylcysteine. Okay. There we go. How many? Okay, 6 studies. Clinical effects, new approach to patients with non-alcoholic steatohepatitis and acetylcysteine in patients with non-alcoholic fatty liver disease. This one's recruiting. If you have non-alcoholic fatty liver disease, you could be recruited into this study. Fatty liver disease in obese children. Effect of multi-ingredient visceral adiposity. Okay, that just means fat around the organs. That's why people have beer guts, big giant bellies. That's what it is. It's visceral adipose tissue. It's not just chunks of fat laying around. It's all in the, around the organs and just sort of in the peritoneal cavity, and some is in the skin. and non-alcoholic fatty liver disease in individuals with abdominal obesity. So, your question is an excellent one, and yeah, I think that it's probably going to. I mean, right now, it's looking pretty good. We'll get. The nice thing about it is N-acetylcysteine dirt cheap, so they have to get NIH grants to get this because no pharmaceutical company is going to fund these tests. But anyway, all right. And yeah, I don't give a shit. I'm happy with 23 viewers. Cardiff Electric and Tukey and Nobody Loves Onions. They're dealing with thousands of concurrent viewers. I'm happy with this. And, the audio goes to my Patreon, so check that out at patreon.com/weirdmedicine. 100% of questions asked over there get answered. Let's see. What else we got here? Radish gifted 1 Weird Medicine membership. Thank you. And Saxon Savage got it. Excellent. All right. Yeah. Anybody else have anything else? Did I miss anything? I think that's good. I mean, I just wanted to do a quick live stream. 45 minutes is probably enough for my stupid crap. And I will continue to work on this. This is better than it was, but it's still not what I want it to be. And yes, Amanda or Kim Chickens, I need a producer. So easier said than done in Upper East Tennessee, if you know what I mean. So, all right. Why can't I get rid of that? All right, my friends. That's we're going to be live tomorrow at 1 o'clock. I do know that Tukey Soup is tomorrow at 10 a.m. Eastern on the Bedabbler network, and I know they've got a special guest tomorrow. It's going to be interesting. People are trying out for Ralph's job. I think Ralph eventually will get his job back. If you don't know what I'm talking about, just join them over there tomorrow, and you'll get some idea. It's fun. It's a goof. I was up till 4 a.m. watching Tukey because he's in Colorado, so his midnight is at 2, and I was just sitting in front of the TV, just mesmerized. So check it out. It's the craziest thing you've ever seen. If you don't know who Tukey is, just go to Bedab. It's part of the Dabbleverse. If you're not into Dabbleverse stuff, it won't mean much to you. But I have a friend who I turned on to the WATP, who's now sort of Dabbleverse adjacent. So check out who are these podcasts. Check out the Creep Off. And if you want to hear me on the Creep Off talking about America's most prolific serial killer, who, by the way, was a physician, check out the one called Concrete Enema on the Creep Off. And then if you go into our Patreon, I have my set of, well, you know what? Why don't I just show it to you? My set from the Creep Off roast. Let me see if I can find it here. Now, I got to do this without doxing anybody again. And I've got to go in and make sure that I edit that one section out. Okay, let's see. Bear with me just for a second. Okay, I think I found it. Here we go. Now, I don't know how this is going to work, so we'll try.
Andy, everybody! Our next presenter is twice the doctor that Dr. Phil is. Unfortunately, that number is still 0. Everybody give it up for Dr. Steve!
Dr. Steve! This will be mostly painless.
This won't hurt a bit.
Vladimir Putin. Oh, I'm sorry. Wait, that's for the Tom Myers roast. Hey, I'm Dr. Steve from Weird Medicine. I'm the oldest person here. I'm about as old as Joe Biden. I read an article recently that said age contributes to memory loss. It also contributes to memory loss. Pause for laughter. Read the line twice. All right. Phew, thank God. I first met Carl because of my job in radio. I also work in hospice, which is the job I wish I met him at.
Yes!
You know, there were meet and greet tickets tonight that were $80. Tickets without a meet and greet were $100. Now, I do want to say, I had never done anything like this before. I mean, I've been on Opie and Anthony and Howard Stern and, you know, quite a few times, and Jim and Sam. And I've been on stage with the WATP a couple of times. The first time in Nashville was the most nervous I've ever been doing anything. I was prepared for this, but I wasn't prepared for standing up there, and now I understand it. I understand where my comic friends get their rush from, because to have everyone looking only at you and laughing only at your words was really something. Now, I worked 2 months on this. I had help from a lot of my comedian friends. I wrote probably, I don't know, half the jokes. And thanks, John's Ear. John's Ear Mites became a member. Thank you, Myrtle. Well, old John's Ear Mites became a member. He certainly did. But I got these just globs of jokes from different people. A couple of the comedians, I didn't use anything that they sent me, and I still had to put it together in a cogent. And the day of the thing, I was still rearranging. But I've been practicing this for about 2 months, so I wasn't very nervous. I thought it would land. I just wasn't prepared for what it felt like to have people watching me just say things and laughing. And I'm hoping that you guys are hearing this okay. Okay, that one's okay. Let's talk about the elephant in the room. Not you, Vinny. I'll get to you. Carl's teeth. Yes, he has worse teeth than an English brothel. You always know Carl's getting ready for bed when he's in the bathroom putting toothpaste on a jigsaw. No. Carl's a trendy guy. He buys his dental supplies at the Gap. That's all right. Vinny and Carl are a great team because Vinny manages a club and Carl has one for a foot.
Synergy.
Vinny's a wrestling fan. Carl is a Star Wars fan. Every summer, they like to go to the beach and see who can get laid less. All right, that's enough of that. Anyway, if you want to check out more of that, check it out at our Patreon, patreon.com/@weirdmedicine or /weirdmedicine, or you can go to the Creep Off Patreon, and I'll eventually just post the video. All right. Thank you, Radish Diff, for gifting One Weird Medicine membership, and John's Ear Mites got it. Nick Illig, brother to Captain Mike, but I'm friends with Mike Illig, but Nick is the one who's a patron of my show and is interactive, and this guy I've never even met. So I think he's the good brother. But anyway, Nick says, if so many men die from heart attacks, why shouldn't we get cardiac CTs and carry nitroglycerin around our necks? Well, again, the risk of nitroglycerin, particularly if you're taking Viagra or Cialis, which, Nick, we know you are. I don't know that you are. I'm just saying that. Is much, much greater than the risk of just randomly having a heart attack if you're not at risk. Now, the cardiac CTs, yes, if you have a single risk factor, I think you should get a cardiac CT. They're $50 most places. You don't even need an appointment. A lot of times you just walk in and it'll give you some idea of what your risk is. If it's 0, you're not completely out of the woods. You can have a cardiac CT score that just is 0, but you have soft atheromas in there. In other words, blockages that don't have calcium in them. But still, If you've got one that's 400 or 500, you know you're at higher risk than you thought you were, and you need to see a cardiologist to get your risk factors under control. It's all about risk mitigation. That's it. That's all we can do. We're going to die unless we hit the singularity and we can upload our consciousness into a machine. We're going to die eventually. So what you can do, though, is reduce your risk of dying early or dying a horrible, horrible death, which I will be talking about on Dave Landau's show, Normal World, very soon. Radish Tip Network gifted 5 more memberships. Thank you, my friend. That's outstanding. That's outstanding. Radish Tip, Radish Tip is always around. He's always around in all the chat rooms that I'm in. Some of you saw my Christmas card this year. Somebody did an AI, and it was me sitting over my phone with a crying cancer kid in the background saying, hang on, Billy, you'll get your tramadol as soon as I send more gift memberships for Tukey soup or whatever. It's ridiculous, but I am sort of an idiot. But I appreciate you all becoming members, but Radish is always around, always very supportive. Really appreciate Radish, whether him or her, don't know, don't care. It's okay. Them, Radish is awesome. All of you, I want to send a shout out to Kim Chickens, Saxon Savage, John's Earmites, King of All Diffs is always around as well, always very supportive. Cindy Walker, Kinky Loco. Well, if I kept playing that, there's a really not well-crafted joke. It's not well-crafted joke about Kinky Loco, but he reached out to me saying, hey, I'm going to be there, so I wanted to at least mention him, and it was terrible. But anyway, all right. Yeah, and I said Kim Chickens already. Crystal Williams. Oh, could depression medicine work on an individual if they have undiagnosed or untreated ADHD? Well, it depends on which depression medicine, but yeah, they will very often use Strattera for ADHD if people don't tolerate stimulants. Thank you, Radish Tip, for another 5 gift memberships. Strattera is basically an antidepressant, and it is reasonably effective for a subset of people. So yeah, it can work, and it can work for depression. It can work for ADHD as well. So, talk to your prescriber, obviously. And then there are different depression medications. People with undiagnosed ADHD who take, say, ketamine, for example, that shouldn't have any impact either way. So, all right. And Richard Kish, thank you for providing useful, interesting information, Doc. You rule. No, you rule. My friend who is also into progressive rock. That's Richard Kish, everyone, who Dr. Scott thinks his name is Kush because Dr. Scott's a hippie, and Hindu Kush was his choice of marijuana, I guess, back in the 60s, man. He's not part of your system, man. Anyway, so, all right. He tried to get Amanda a membership. Yeah, you know what? I can't just give people memberships. Okay, so he's doing Radish Dip. I can refund you some of this money. I don't. Okay, so let's see. Dead Baron is getting it. Steve, Josh Brony. I bet Amanda doesn't have accept gift memberships on. So Amanda, you have to go into your settings and accept gifted memberships, and you can even get them when you're not here. If there's not enough people in the chat room, it will start hitting everybody else. Chris Robinson became a member. Yeah, so anyway. Hey, thanks. JJ, HZK, RFN. I always make fun of Tukey and those guys for not being able to read these names, and now I see why. It's easier said than done. But yeah, Amanda, go in and do that setting, get that set right. And then I'm going to work on this this monolith from 2001 to my left, where the chat's supposed to be, so that I can interact with you in real time without turning my dumb head. Anyway, all right. Radish Diff, I'm going to guarantee you she doesn't have that turned on, so we'll get her turned on Yeah, I think you probably already turned around. So, oh, my sound is low. Okay, I'm sorry, my friend. I can fix that. How's that? That looks a little bit better on this end. I had turned it down earlier for when I was playing a video and forgot to turn it back up. I hope that's better. All right, Q, thank you. All right, my friends, take care. I hope you have a great night. And thanks again for hanging out. We'll see you tomorrow, 10 a.m. on Bedablin Live, and 1 p.m. for the regular Weird Medicine show. I'm going to keep working on these. I'm going to try to do Friday nights at 8 p.m. for a while. And every week you should see some new technology, and it should be getting better and better. So thanks again. Thanks for bearing with me, and take care. We'll see you soon.